feeling we're progressing enough here. I'm not going to spend a lot of time on like the stuff you know how to do, like effleurage and petrissage and all the details of that.
You have a pillow underneath?
We do have one pillow. I may add more as we go here. Really set up the table, so she got that covered. Okay, effleurage, petrissage. On the Tibialis anterior, there's a little bruise. It's a sharp smallish. So kind of where that bruise is, there's a trigger point area here, and it refers down into the ankle and the big toe. So just to start, I mean, we're basically what we're doing for the crural fascia and the elongating of tibialis anterior and peroneus or fibularis longus and brevis is similar. I'm using the heel of my hand just because it fits so nicely in this area. I don't think I would use knuckling on this area because of the tibia. It's just too easy to hit the bone. So you can kind of just ease from one to the next during doing your elongating for the crural fascia. And then if you want to continue to use the heel of your hand for tibialis anterior and peroneus fibularis longus and brevis, you can do that. If you want to use your fingertips, but again, I think I would avoid the knuckles. So the fingertips are a little bit more sensitive than the heel of your hand, so you might feel some knots. Any areas of tenderness while I'm working?
Lower than that, towards the lower part.
Down here?
Yeah, there.
Right in there. Yeah, and that's actually pretty much where the trigger point is on the map. If I press on this, does it?
I can feel it in my the tip of my middle toe.
Okay, there you go. So we have some referral there. So hold your points, have them take their 3 deep breaths. Somebody asked me last week, commented that the 3 deep breaths didn't seem like that long a period of time to hold. It's, you know, you can hold them longer. The recommended kind of window time is no longer than a minute, just because it gets kind of intense. And then of course after that you want to just rub it out, so make them a little happier after you've been leaning on them. So up to a minute. Sometimes these things have taken a long time to set in place, so it may be that you're going to be seeing them for a series of treatments, working on it a little bit more each time. In between those times, it would be good to have them doing stretching to keep things loose. But the 3 deep breaths is nice because I think because it brings the breathing into the process, and I can feel the relaxation with it. I used to not use that method, and I since started to incorporate that. I can feel the relaxation as they're doing the breathing more, and partly is I think it's just they're more aware of relaxing, but it does the breath definitely does help assist the whole process. So on your maps, peroneus longus and brevis has a couple trigger points on the outside here, and there's some people have a tertius, which is a little bit lower down in the ankle in here, and that looks a little more localized as far as the pain distribution area for that. Okay, so quads. If you want to work the top of the foot, just to complete the foot. There probably are trigger points on the top of the foot. I'm not focusing on that, so you can just do kind of a feel-good massage if you like. So quads are one of those muscles that can be really tight on people who are fairly athletic. And if they have, you know, lower body fat, sometimes you just see the muscle itself. And so it might be helpful to kind of pin the muscle.
Too much oil on my hands.
So just right at the top of the patella here, once you've done your effleurage and petrissage, can be helpful. Try to keep my hand from going under the drape. I have a little bit too much oil on. And if you find that your hand just keeps slipping off, you can actually sort of do it in little chunks. So do as far as you feel like you can, and then pin and go a little farther. Because this is a really narrow muscle, and it can be very tight, and you can find yourself just kind of slipping off of it. Medialis, I just have my flat hand on the outside to balance, and I'm pressing pretty deeply. This isn't the best in terms of body mechanics, because I really am outwardly rotating my shoulder. I'm coming in, but with the hand on the other side, you're getting a kind of a opposing compression.
You're pushing the muscle up with your right hand?
I am giving a little force back with the right hand, just kind of counter pressure. And lateralis, same thing. I tend to kind of put my elbow into my hip and just sort of lean on for a little more pressure if I need it. You certainly can use your knuckling techniques for this. That's tender.
Mhm.
Is it tender or is it?
It's really tender.
Okay.
It's tight.
It's tight.
Mhm.
Okay. Does it feel? You know, trigger points have that characteristic deep ache. Is it feel?
It's a deep ache. Yeah.
Okay.
It's like right up against my femur.
Okay. And it's very tender. So I'm not even pressing hard at all. How's that pressure?
You can go a
A
little more.
little deeper. I can press into it a little more. Let me know when it's a good pressure.
Go ahead a little more. That's good.
Right there. Okay. So I'm pressing maybe about half of what I would normally. Does that refer? No. Okay. It might just be a tight muscle. So if you get a tight muscle, you can just do your regular friction thing. So I'm just going to kind of sense where the fibers are, use my thumbs or fingertips to move through there. I'm not seeing it correlating to a specific. There's up more higher on rectus femoris. There's more of a trigger point area. You know, rectus femoris is pretty much straight up, so this is more vastus lateralis. It really is quite tight. You can feel the fibers. So you can just do some kind of local stretching with your fingertips or thumbs. We could do some knuckling as well. T-band is going to be more straight lateral, so to encompass the vastus lateralis. You know, IT band goes over the top of it. So it's pretty tender all the way around, isn't it? Yeah. I could do also some knuckling if that was tolerable. Okay, vastus lateralis is going to come off of the iliac crest here. So I'm just going to come off the muscle itself here. All I'm going to do is just roll your knee inward. Just go ahead and just do like some, just leave it as flat. Go back to where, back up. There you go. I just want you to roll in because I want to feel where the muscle is. Okay, relax. So she's medially rotating. So I'm just feeling the muscle right there. Is that pretty sore there too?
Not as sore as
Okay,
vastus.
so it was more vastus. Okay, so I was just defining of where exactly is the muscle by having her medially rotate. And it's not that long. The muscle itself isn't that long. So I'm going to be getting onto the IT band pretty quickly, and then of course I'm going to give some counter pressure here, so I'm not rolling your leg in. And you could go, we're going origin to insertion, but I think you're okay to go insertion to origin if you want to. Just work up from the lateral knee and end on the muscle. Tender. Okay. Are you okay?
Yeah.
Her muscles are talking. So those are the things that we're watching for. There wasn't any kind of gross flinching or ouch, but her muscles just went, it's kind of, twitched under that. So figuring out where your soreness is, and then figuring out some nice stretches for your patient to do at home. So with our adductors, let's see, I'm going to just use my knee. The table's low enough I could probably just use my knee. So we're going to bring the knee out slightly, and I'm actually going to have you can have the patient hold the gown like that, or hold the drape, and then that relax. So I'm just going to kind of talk through it. So we're going, remember a lot of the adductors come down here to the pes anserine on the knee, and adductor magnus comes down here on the top of the medial epicondyle, and then we have our hamstrings semitendinosus posteriorly here. So enough oil coming up. You can use heel. The tricky thing about using the heel of hands is you have to let your fingertips go up as you come to the medial thigh. Do not let them go under the drape. Don't let them disappear under the drape. Don't lose track of where your hand is. So you can do lighter, if you will, knuckling coming up on the medial thigh. I could also use the outside of my hand here. And for a good number of people, especially if you're pretty athletic, these are going to be pretty tight. So they really are very medial. We don't have to go vastus medialis is here. You've got a nice vastus medialis right there. You can see it clearly. So you don't want to be going farther than vastus medialis here. You want to stay right on the medial thigh. Okay. There are some trigger points. Actually, adductor magnus, it shows on here, does have pretty far up because it goes along. Remember all that stuff that we palpated that everybody was afraid of in palpation, going inferior ramus of the pubis and ramus of the ischium. There's one that's right up in there that actually the trigger point area is internal, like in the colon, in the bladder, in the intestines. So it's just interesting that some of this stuff, the pain area is not necessarily muscular, it can be also visceral. Okay, so let's go to iliopsoas and so I did mention you could do just like sort of a passive hands-on before you undrape, just to, because it's a vulnerable area. I get the person used to the fact that you're going to be touching their abdomen. Just doing a few breaths to help you relax, help them relax. And some of the stuff is what we did in Bodyworks 1. Remember our F4 circles, starting with fingertips facing away. One hand drapes over the other. The left hand drapes over the top of the right. Do that as much as you want. Get the oil spread and things relax a little bit. Our petrissage was this sort of undulating heel in across fingertips. And the idea is you're compressing first the ascending, then across the transverse, and down the descending. And some people do it in just sort of a straight across, sort of a push-pull. And some people kind of swing it a little bit, circle. So either one is fine. And then the diaphragm release is, I'm going to place my hand on the ribs, and we're not actually, of course, really getting up to the diaphragm, but the insertion of the diaphragm is up under the ribs here. So if I bring my, if I pull the skin down a little bit, loosen up the area, my knees are somewhat bolstered. It doesn't feel real tight. It helps to have the knees bolstered just to relax the abdominal muscles. So I can trace my thumb. You can also do fingertips, but you have to make sure that your nails are really short and you don't have any hangnails. But I can trace my thumb along the edge of the ribs here. If things are really tight, you can do it on the out breath, just to increase the relaxation. So I'm just kind of pressing down here to relax the skin, and then fingers are tracing along the ribs here. So we can do that on both sides. So I'm just going to do one side right now. And then the diaphragm, it's kind of a fun overall. So I'm going to start both hands, and you guys need to see, right here, fine. It's coming straight up, and then splitting and coming, tracing along the costal margin here. Fingertips come into the low back, and some might even touch. And then I just lean back, and that lifts, it opens up the low back. And then I start again, fingertips up, or thumbs I should say, along the costal margin. Underneath, my fingertips are just coming in towards each other like this, kind of accentuating the arch of the back. I lean back and lift up. And do a few passes of that.
Would you trace both sides first, or just because you traced?
Yeah, I did just half. So I would do this side, then I would come around and do this side on the diaphragm release, and then do this, yes. This is moving on quickly. Okay, so we're going to do iliopsoas, and I think I'll do bolstering on the side. So we're going to bring your knee up and up. There we go. Okay. So any tenderness here in your abdomen?
Once in a while.
Okay. How about today?
Not today.
Not today. Okay. So the iliopsoas, there's a couple of trigger points. One tends to be close to the origin. So the spine itself is pretty big. It's pretty wide here, and I think we're about L4-ish here. So it's coming off the bodies and the transverse processes of the lumbar spine, ducts underneath. So here's your ASIS. Ducts underneath the inguinal ligament comes down to the medial thigh on the lesser trochanter. So if I find the ASIS and come up here and then come across into the umbilicus, where they intersect is pretty much where I want to start. So I'm not way over here on the side, and I'm not too far medial, but I should be kind of right close to the edge, lateral edge, if you will, of the intestines. And I'm just going to slowly, remember this from palpation class, right? So slowly circling in. It's doing a very nice job of relaxing. And again, you can also do this on the out breath. Is that okay? Mm-hmm. Okay with that. And you may actually feel some rigidity when you get close to the spine. And to test that you're on it, I'm just going to start to lift your knee up. Good, there you go. And if you do too much, the abdominals will kick in. So I'm going to go along the origin here, right on the edge of the spine. you feeling it?
Mhm.
Yeah.
Sorry.
You don't make her laugh. She's not gonna do this. This is like she's
This is the
done
last
now.
time, yeah.
She's done. So I basically was just going right along the origin there, along the spine, and then you can also follow it. You're kind of just like lengthening it as you come down toward the inguinal ligament. I've actually never been very successful at finding the lesser trochanter, although there are some massage therapists who kind of specialize in that, and it's really deep in the medial thigh. But I think if we can follow the origin and then lengthen it along its body, we're going to be going a long ways in helping to release it. Okay, and then you might do some nice circles just to make them feel better after you've dug in their abdomen for a while. But actually releasing the psoas can be really, really helpful. And then we had our nice, where'd you go, Jim? We had our nice stretch. So some people have a person lay on their bed and just hang their leg up, scoot up to the edge of the bed, hang your leg off the edge. You can find these on YouTube. On the massage table, they can hang on the massage table and then just let the leg hang off the table, and then you can support them if you want, with the stretch, or they can do that kind of a, stretching if they need to stretch in between moves.